In a previous video, we talked about the impact of correcting an upper cervical problem and how it altered posture, and how a person who had been a long-term firefighter with chronic sciatic and low back issues had a 100% recovery with one correction and then stabilization. In other words, the patient actually staying right over the course of about 4.5 months or 18 weeks. So, and that's something that should be out shortly in a journal. But you might be wondering, well, how does the upper cervical spine and its influence on posture change somebody's low back or sciatic pain? And so that's what I'm going to do, is I'm going to kind of talk with you about how the two things fit together. The thing that you're looking at right here is what we call an anatometer. We usually use the term instrument, but this thing helps us to measure a handful of variables within patients. Number one is the anatometer measures whether the hips are high or low, whether the pelvis is high or low. It helps us to measure whether the pelvis is translated one way or the other, whether the patient's body is translated. It also measures whether the top of a person is off one way or the other. And then there are plates down here in the floor that are hooked up to transducers, and it takes a reading. It tells us if you have more weight on one side of your body versus the other, how balanced you are. We correlate these findings on the anatometer with the findings that we find from a supine leg length inequality measurement, and we put the two together to determine what kind of postural problem does a person have. Now you might be thinking, okay, what does that have to do with the neck? Well, it just so happens that if you have pressure at your brainstem, the reticular formation, it'll cause one side of your body to contract more or pull up. And when it does, it'll make, when you stand, the hip low, it'll change how you carry weight, and it'll affect your posture detrimentally. And so what it is that we do here is, through image-guided care, we figure out how the head and the neck, through imaging, how they're injured, and then how to restore the head and the neck to where they should be, removing the pressure from the brainstem, and then altering the person's leg length and postural measurements. This is the device that we do that through. This is how, in that other study that we were discussing, how somebody had a long-term or 7-month chronic sciatic and low back issue, and how they had 100% recovery with one correction. How did that happen? Well, we changed their posture. They went from having 18.8 pounds on one leg down to under 2. They went from having a short leg to having level legs and balanced hips. So this is one of the metrics or devices that we use to evaluate the success of the correction of the upper cervical spine and its impact on posture. Now, most of you haven't seen this before, and that's because there's not a lot of them out there. There's about 50 of these out there. 3 are located in my clinic, and this is called the Anatometer, as I mentioned earlier. This, I think, is part of what I would consider to be the gold standard of the NUCCA doctor. In other words, coupled with imaging before and after, coupled with a very specific leg length inequality measurement, and then taking postural measurements with this, it allows for us to determine, one, what does somebody's posture look like, and then number 2, the effectiveness of correcting their postural imbalance due to a problem up at the base of their skull. And so if you're somebody who has a postural problem, it's likely you could be helped with the procedure that we do. Frequently, people who've got low back pain, sciatic issues, different structural problems actually have a postural problem that's creating or relating to the symptoms that they have. And so if you have a postural problem, it's likely you're a candidate for what we do.